Hi, my name is Chelsea. Today we're going to be doing trach care. So first thing I'm going to do is I'm going to come in, introduce myself, let the patient know who I am, and close the door, draw the curtain for privacy, make sure that the vital signs are stable today, and then get started. So I'm going to go ahead and perform my hand hygiene here. And I have my trach care here. So I'm going to peel it away. Shiny side goes down. I have my sterile gloves here. I'm just going to put that to the side. Dump everything in the middle. Save this because that's where we're going to put all of our solution, like the hydrogen peroxide and the normal saline that we're going to be simulating because we don't have that. I do have everything here. Normally we wouldn't be touching everything, moving it all around like this, but I just want to show that everything is in my kit. I have my gauze, the strings, and I do have these swabs here as well, and the brush to cleanse the cannula. And then, like I said, I do have my sterile gloves here. So after I go ahead and perform the hand hygiene, we're going to go ahead and put on just some clean gloves. And then what I'm going to do here is we are going to go ahead and remove the cannula here. We're going to insert it here so that it's clean. Clean it with the brush. All right, make sure that that's good to go. And the patient's tolerating everything well. Now let's try. We're just going to go ahead and place that back in. Make sure it doesn't move during the video. Okay. All right, perfect. So now I'm going to go ahead, remove these gloves, throw it in the trash, and we're going to get started and move over to the sterile portion of this. So I'm going to perform hand hygiene again. Of course, if this were in real time, we would not be reaching over the sterile field, but due to limited space, I did reach over. So I'm also going to bring my gloves over here. Again, we would normally not do it right in front. And we would go ahead and open this right here at the tabs here. And there's little flaps that you can't quite see probably in the video, but in order to maintain that sterile field, you're going to pull that cuff. And I'm going to move over back into this cuff, put on my other glove. Then I can adjust now that I have it on. And then, again, this would just go in the trash. Okay. So now, important thing is we have to have a clean hand or a sterile hand and then the dirty hand. So now what I'm going to get ready to do is I'm going to clean around the stoma. This is going to be my clean hand, or excuse me, my dirty hand, and this is my clean one. So I'm going to go ahead, make sure that I pass it over, and I'm just going to clean around, monitor for any drainage, swelling, tenderness, also talking, to the patient, making sure, checking to see if they're comfortable as well. Then I just go ahead, dump that in the trash, grab another one, pass it, just to kind of clean it up a little bit. This would go in the trash, pass this one over, dab, make sure it's nice and dry. Then now what I'm going to do is I'm going to grab this one, and get ready to use either the Velcro, but in this case we have the string to kind of keep everything in place. And at this point, we're not sterile anymore, but it's okay because we cleaned up. I'm just going to loop this around the patient. I didn't show this, but just like the professor had it, I did make a little cut already so that it can go through the loop. And I would just gently bring this around and back of the neck here. I'm going to put it through the loop, and I'm going to tie it, make sure that it's comfortable for the patient, and then also stick a little gauze just to make it a little bit more comfortable, just in case, you know, we want to prevent as much as possible, including skin breakdown, excuse me. All right, perfect. So now that that's done, we're going to go ahead and remove our gloves. We're going to throw everything in the trash. Patient stable, good to go. And then perform hand hygiene. Talk to the patient, let them know what you've just done, or see if they have any questions. Again, make sure that they're okay. Leave the call light. And then I did forget to mention, it is really important to have this patient in semi-Fowler's position. It's a comfortable position for them while they're doing this. And then I would step out and document, and that's it. Thank you.